Welcome to our discussion on why cognitive behavioral therapy, or CBT, isn't optimal for PTSD treatment. Let's delve into the key points. 1. Surface level approach. CBT often zeroes in on changing thought patterns and behaviors. However, it might not always delve deep into the root causes of trauma, potentially offering only temporary relief. 2. Rehashing traumatic events. CBT sessions can involve revisiting traumatic events. This can be re-traumatizing for some, especially if they're not prepared to face certain memories. 3. Lack of emphasis on the body's role. Trauma often resides in the body. CBT might overlook the somatic aspects of trauma, neglecting the nervous system's role and how trauma physically manifests. 4. Potential for reinforcing avoidance. While aiming to confront negative thoughts, CBT might inadvertently reinforce avoidance behaviors if trauma isn't processed adequately. 5. Over-reliance on verbal processing. Traumatic memories can be fragmented or sensory. CBT's verbal emphasis might not effectively access these non-verbal traumatic imprints. 6. Potential for over-pathologizing. There's a risk of individuals feeling their trauma responses are wrong when they might be normal reactions to abnormal events. 7. Lack of focus on building resilience. While addressing negative thoughts, CBT might not always emphasize building resilience in the nervous system, vital for long-term recovery. 8. Missing the role of relationships. Relational trauma deeply impacts interpersonal dynamics. CBT might require more specialized approaches for such nuanced traumas. 9. Lack of personalized approach. PTSD can manifest differently among individuals. Standardized CBT might not cater to everyone's unique needs. 10. Limited scope. By focusing mainly on thoughts and behaviors, CBT might miss the emotional and physiological aspects of trauma. 11. Potential for dependency. Without the right tools, there's a risk of becoming overly reliant on therapy sessions. 12. Lack of emphasis on nervous system. The nervous system is pivotal in trauma recovery. Traditional CBT might not prioritize its understanding and healing. 13. Traditional versus somatic approaches. Traditional therapies like CBT might not emphasize healing the nervous system as much as body-first approaches do.
As we conclude our exploration of CBT's relationship with PTSD, it's essential to remember that every therapeutic approach has its strengths and limitations. While CBT might not be the optimal solution for everyone, it has provided relief for many. The journey to healing is deeply personal, and what works for one individual might not work for another. It's crucial to find a therapeutic approach tailored to one's unique experiences and needs. Thank you for joining us in this deep dive, and we encourage you to continue researching and seeking the best path for your well-being. Until next time, take care and be well.